Hello, my name's Tony Bukta. I'm the owner of Central Ohio Compounding Pharmacy. We're located in Columbus, Ohio. And I'm here today with my good friend, John Herr. John's a compounding pharmacist that owns Town & Country Compounding Pharmacy in Ramsey, New Jersey. We've been in practice for over 25 years, and one area of specialty we have is men's health. And that's what we're going to talk about today. In particular, the journey that men have to travel dealing with erectile dysfunction. Erectile dysfunction is very common, often not talked about, and it should be. It can happen for a variety of reasons. It could be as a result of disease, medication therapy, possibly a result of a surgery, or just natural aging. But there's a lot of treatment options out there to address these problems. We're looking forward to working with you and your physician to customize your personalized care so we can help you achieve your results that you're looking for. Many of the men that we see at the pharmacy that are suffering with sexual dysfunction can be treated with a number of options. Either oral medications like Viagra, Cialis, or possibly a sublingual version of those medications, a vacuum erection pump, or even a penile injection.
So today we wanted to talk about the penile injection, which is commonly known as Trimix or Quadmix. And we wanted to talk about, how to use it, how to store it, and how to inject it.
These medications are temperature sensitive. Either it'll be stored under refrigeration or it'll be stored frozen. But we'll go over that with you, and it'll be clearly labeled on your medication when it is dispensed at the pharmacy.
That's a good point, Tony, because I think when both of us started making these injections in our pharmacies, we typically used a 5 ml bottle, and many of the patients are very used to getting in the 5 ml bottle. And now it's become more common to get, what we see as like 5 by 1 ml vials. And do you get questions about that from your patients? Like, why was that changed?
Yeah, it's come up, and they're just not really clear what that was about. And we explained to them with the government regulations, the change in how we operate in the pharmacy, that it's being required. But it also improves the quality of the product, that they can keep 4 of the vials stored in the freezer and then just use the one as they need it. So it kind of extends the potency, the effectiveness of the medication.
Yeah, that's a good point, because even though there's many articles out there that say that it's stable for 30 days refrigerated or up to 6 months frozen, due to the new USP guidelines, it really should be refrigerated for 3 days and frozen for 45. Hence the little 1 ml vials instead of getting the larger vial. And actually, we've gotten a lot of feedback from our patients that by keeping only the 1 vial in the refrigerator and the other vials frozen, it seems to maintain its potency and its effectiveness better.
Yeah. We've seen the exact same experience with our patients. And one of the things that even happens is they like the small vials for traveling. You don't have to carry everything with you. They can just take a 1 ml vial. It's easier to transport on a plane and have with them on their vacations. So John, one of the questions we get is how long is this good for? So what type of expiration do you assign to your medications?
Well, it's a good question, because as a compounding pharmacy, we always make the medication exactly to the patient's specification in conjunction with working with the urologist. So we can make any combination, but when we do that, because we didn't have a stability study, then we're required to keep it 45 days frozen as a maximum expiration date. Now, I know at your pharmacy, you do have a couple strengths where you do have a stability study. And in that case, as long as we follow that study, we can make that exact strength, and it's actually good for 6 months frozen. Again, we're a compounding pharmacy, and we like to customize our medication to the patient. But oftentimes, if you're just starting off with the medication and your urologist is familiar that we have these particular stability studies, he or she may wish to start with that medication, because if it is right for you, it is more convenient to have a medication that can last for 6 months. And patient-focused professional pharmacies such as ours also try to make things easier for the patient. One of the things we have is an injection kit. It comes with everything you need to prepare and administer your injection. It comes with the syringes, a nice instruction sheet to go over. Now, we do recommend watching the video, but it's also good to have written instructions in conjunction with the video. And alcohol swabs, which we'll need for both swabbing the vial and also swabbing the penis, Tony, could you maybe show them how you would draw the medication out of the vial? It can be a little confusing. How do you explain it to the patient?
Sure, John. Let me go over that for you. The first thing we tell our patients to do is to take their medication out of the freezer, take out one vial that they're going to be using, and then return the rest of the medication back to the freezer for cold storage. Even though this is frozen, you can hold it in your hand for a minute or maybe 2 or 3. It's a small volume, so it'll melt pretty quickly. This one's already ready to go. So first thing you want to do is remove this foil seal. It's a tamper-evident seal that we put on just to indicate that it's been a compounded medication. And then once you remove this, you'll be able to know this is the vial you're going to be working out of. First thing you want to do is use an alcohol swab. This is very important to clean the top. You'll want to start that by just putting a few sweeping motions to remove any potential contaminants, but also kill any bacteria. You'll want to let that completely dry because that's part of the killing process. So you want to make sure that happens to ensure sterility. While that's drying, we can prepare the needle. First, you'll want to remove the plunger cap and just set that off to the side. You're not going to need that again. And then the needle cap. Important thing to always remember with the needle is to ensure nothing comes in touch with the needle surface. This is going to be injected into your body, so we want to maintain sterility at all times.
Hey, Tony, you know what I was just thinking is we get a lot of questions, and I think it's confusing because we typically use an insulin syringe, which is dosed in units. What do you tell your patients about that?
Yeah, that happens all the time. So we'll let them know 10 units is the equivalent of 0.1 milliliters, and they can always look on their label. It'll be specified what that dosage is going to be that they're going to need to draw up in their syringe.
Yeah, that's good information because I do know that confuses a lot of patients because your urologist may mention you're going to inject, 0.1 ml or cc's or 0.2, and then they get the syringe that says 10, 20, 30, and they get confused.
They don't really know what to do, but we'll always go over that. It'll be in the instructions that we'll send out, be on the patient, on your prescription label, and always refer back to the video or call us at the pharmacy. We want to make sure you use your right dose every time. So now that the vial has dried, we're ready to enter it. So the first thing you want to do is pull back on the plunger to your dose. So you'll be injecting air into the vial for an equal exchange of what you want to draw out for your medication. So when you enter the vial, you go directly into the rubber stopper like that, invert the vial, push the air into the vial, and then draw out your dose. You'll probably want to draw out a little bit more just to make sure you can get any air bubbles out of the vial, out of the syringe. Tap that, and then push up to the required dose. Pull that back out. You can set that vial off to the side and then replace the cap to protect the integrity of the needle.
At the point when you have withdrawn the needle from the vial, you could be ready for injection, couldn't you?
Right, you could be ready to go.
Okay.
And so when we talk to our patients, one of the things we often say is you can even draw it up an hour or so ahead of time. So you're ready to go. Just put this back in the refrigerator until the time that you need it. So either way is totally acceptable. Just depends on each person's individual needs and timing.
Yes. And that was a good demonstration. And one of the other things we always mention to the men, it's much easier when it's a brand new vial, but you might get, 3 or 4 doses out of each little vial or 5 doses. It really just depends on what your doctor has prescribed as the dosage. So it does take a little technique as the volume in the vial goes down over multiple uses of not having the needle of the syringe all the way up into the vial. And that's a little technique, and over time you kind of learn that.
Yeah, you get it, definitely. Now, John, in your experience, what are some of the comments that you hear from men getting started on Trimix or penile injections?
Well, actually, fear. I mean, many people are needle phobic. A lot of people don't like needles. But, to be honest, just the thought to any man, the thought of actually taking a needle and having to inject their penis is very fearful. And, it's understandable. For that reason, often it will make a test dose. It does have to be patient specific, but we can prepare the dose in like one small vial like that. We label it with your name and we can send it to your urologist, and then he or she can instruct you in the office for that. And I have a story of a patient one time who, had his prostate removed due to prostate cancer, and just he thought his sex life was over. And he was just so apprehensive about injecting himself. And finally, his doctor requested that he get a test dose from us. We sent it to the doctor's office, and the doctor used the test dose in the office, and he said, wow, that didn't hurt at all. Yeah, that's one of the reasons they use these insulin needles. Insulin needles, they're so fine nowadays. It's not like getting your COVID shot that hurts. It's a fine little needle, and just going to the doctor's office and getting that test dose, I think, can relieve a lot of the apprehension that the man might have about the injection. Now that you've withdrawn the medication in your syringe and it's all ready to inject, we have to discuss, where the injection takes place and how to make that injection. So we have, again, a medical anatomical model of a penis as a demonstration model. And basically, we always tell our patients that on the top of the penis there's more blood vessels, so we never want to inject there. More towards the bottom of the penis is where your urethra is, and that is another area we do not want to inject. Towards the head of the penis, there's more nerve endings, and with more nerve endings, it's going to be more sensitive, so again, you don't want to inject there. So the best spot is the lower third of the shaft of the penis, and easiest way to do that is to take two fingers, run them onto the bottom of the penis up against the scrotum, and then that gives you the area. That's the target area that you want to make that injection. Also, we usually at the pharmacy, I think, as you recommend to your patients, is what is the position that you usually typically recommend?
10 or 2, kind of on the face of the clock, to give you that orientation, approximately a 45-degree angle, so they can inject into the penis, kind of targeted towards the center.
Okay. Yeah, we recommend the 10 and 2 also. Sometimes your urologist may say the 3 and 9 position, again, as the hands of the clock, but why is it that you found that the 3 and 9 sometimes is more of a problem?
It's just that it's depth perception. You want to make sure you're able to see that area well, so you're not injecting into a blood vessel, which, it's not going to be harmful, but it could be painful, and it could make the dose less effective, so you're not going to achieve an erection.
Here's that, that 10 and 2 position. Now, again, you could go to that 3 and 9. And often we tell our patients that they use this therapy for an extended period of time. The idea is not to keep injecting in the same area, because you can get a buildup of plaque. Plaque will then make it harder for future injections. So we like to rotate. We like to stay in that 1/3 on either side of the penis when making the injection. And again, that 10 and 2, and if need be, that 3 and 9 position. If, for example, you were to, inject it lower, you could inject into the urethra. And the urethra is where we urinate out of. So we often joke with our patients, if you were to inject into the urethra, you're not going to get an erection, you're just going to piss your dose away. And again, not injecting in that lower part where I mentioned the urethra, or the top where we have the nerve endings. It's the corpus cavernosa. That's where the blood is flowing in. It's that blood flow in that helps you achieve and maintain that erection. So again, the corpus cavernosa is on the side of either side of the shaft of the penis, and that is our target area to inject in at a 45-degree angle. And in conjunction with using the alcohol pad to clean the vial, like Tony demonstrated, you'll actually also use another alcohol pad to prepare the penis for the injection, because there can be bacteria on the penis, and you want to make sure that the needle is going in through the skin. You don't want to introduce any of that bacteria into the, into the tissue. So you just simply take another alcohol pad. You've decided if you're injecting on either side, and we've discussed all of that, and it's the same as the vial. Give it like 3 wipes and allow the alcohol to dry, because again, that helps with killing of any potential bacteria. And also, if you did not allow the alcohol to dry, when you then inject, it can sting a little bit more. Is there any other things that you can think of, Tony, about the injection technique?
One of the things that kind of gets overlooked and not talked about enough is standing up prior to doing the injection. And by doing that, you're going to allow more blood flow to go south and really improve the erection that you're going to get. So I think I'd like to kind of, I'll demonstrate that, show everybody how that works. Now I'd like to demonstrate the standing position. As we said earlier, this really allows for more blood flow to get to the penis. We've already prepared the penis with the alcohol swab. So now what you want to do is just to make sure you're hitting the right location. Put 2 fingers right at the base of the penis to kind of give you identification of that third that's closest to the body. And again, remembering our 10 and 2 sequencing, 45 degrees angle going directly into the penis, targeting the center. One of the things that has been helpful for a lot of folks is just holding the penis kind of firmly against their thigh. We've already identified the target area, and now we're ready to administer the dose. So it's already been prepared, pre-filled, and so we'll be going directly into this part of the penis. As you can see, we missed any veins. We're going in at a 45-degree angle, and then just slowly depress the plunger and administer the medication. Withdraw the needle, and then apply pressure for about a minute right at the site of injection. This will help prevent any long-term scarring or irritation at that site and improve the effectiveness of the dose. Now once you're done, a minute's passed, then you want to stroke the penis. You can use a warm washcloth as well, just to improve blood flow and create vasodilation. It'll take approximately 5 to 10 minutes to achieve a full outcome and a satisfactory erection. So now that you've had your dose of a medication, one of the tips that we really encourage and recommend is to use the log that we provide that'll allow you to document how effective the erection was, anything that occurred. It becomes a real useful tool as we try to gauge your therapy. As we go through this, John, what type of experiences have you seen with your patients?
Well, number one is sometimes they may complain about the injection itself. They may say that they got a bump, where they did the injection, which we usually tell them that means that you did not inject deep enough. You didn't get into the corpus cavernosa, and that's an indication where, like, for example, if you're using the auto injector, that maybe you would have to adjust it to make the needle go in a little bit deeper, because that bump is telling us that you probably didn't achieve a good erection and it was not placed in the right spot. A man may come to us and say, well, I achieved an erection, but it wasn't firm enough for insertion. So that's something we like to have on the log, as Tony mentioned. And this is really good, especially in the beginning when you're starting therapy, because it helps guide us as pharmacists and also your physician in properly adjusting the dose. That's what we've seen over the years. And eventually you might not need that. But you'll see on here, like if you try it and you say, I had minimal change, that we would mark as like a 1 to 3 on the log. What we're shooting for is, like an 8. That means that you had a stable erection that was firm enough for penetration. But what we found a lot of times when a gentleman tells us that, he achieved an erection, but it wasn't firm enough for penetration, that's a signal to us of, in the Trimix, which is 3 ingredients, that we may need to adjust the dosage on that one ingredient. Example, if you didn't achieve an erection, that could mean that you need to inject either a larger volume, or that maybe one of the other ingredients needs to be adjusted that helps with blood flow. I mean, that's what we normally see. Is that similar with you?
It's very similar, and I think you hit it. Sometimes it's not even changing the formulation, but increasing the volume, and maybe add a little bit more to that. One of the things that we also really try to counsel patients on is if they're experiencing an erection that lasts too long, referred to as a priapism, is that they have some pseudoephedrine on hand. You really want to use the original pseudoephedrine. You have to sign for it. It's behind the pharmacy counter, and that'll help cause that dilation to constrict and alleviate the erection. Some patients may even want to chew up the tablets. They taste bitter, but it increases the onset of action. And if it still lasts longer than 2 hours, you'd want to contact your physician.
Yeah, that's a good point. I mean, it doesn't really happen that often, but it's best to keep that Sudafed on hand just in case. One of the other things we mentioned to our patients, and we have them available in the pharmacy, is a sharps container, because that way the needle that you used, it's a nice way to dispose of it and get rid of it without causing anybody to touch a needle that might have been in a trash bag or something and getting a stick.
Really, the key of using this tool is it allows us to communicate with your physician to really optimize your particular formulation so you can have successful erections and enjoy a very satisfying sex life.
And that's the goal. And again, both of our pharmacies are here to help you. Please contact us with any questions, and we hope this video has been very informational.